Hello, I'm Dr. Tracy Paschke with Heart Health Prevention and Wellness. I'm a board-certified preventive cardiologist, helping people prevent and reverse heart disease. So today I wanted to talk about navigating heart health with a family history of heart disease. So this is a question I get a lot from people. One of my parents had a heart attack or heart failure, and what does that mean for me? I wanted to talk a minute about the impact of genetics versus lifestyle. So, heart disease is a pretty encompassing term. It means heart attacks, strokes, congestive heart failure, abnormal heart rhythm, so a lot of high blood pressure. So, a lot of things fall under the umbrella of heart disease. So you might have a family history of everybody in the family, or a lot of people in the family die of heart attacks. That can be passed genetically. Sometimes it's a problem with the heart muscle that can be passed genetically. That's called a cardiomyopathy. There are different familial cardiomyopathies. Some diseases, you can inherit the genes that cause those diseases, but often it's related to lifestyle factors. So it's estimated that only 10 to 20% of heart disease is attributed to genetics. So that means 80 to 90% is based on what we do with our lifestyle factors. It's important to know your family history. When you're at family gatherings, ask people about their medical history. Often, especially in older generations, often people don't talk about their medical problems. So sometimes you just have to ask point blank, does anyone in the family have history of heart attacks or heart failure? And you might gather some information that you didn't know about. There are some genetic tests that we can do. There's some issues with that. There's not just one test that we can draw your blood and check if you're going to have a heart attack. Unfortunately, it's not that simple. A lot of these diseases, there are multiple genes involved, and we haven't even identified all the genes that are involved yet. Then there are concerns about privacy with genetic testing. If I were going to get genetic testing, I would do it outside of my insurance in one of the private companies, although there have been some concerns about what they do with their data as well. At least it's not tied to your medical record. And then I would focus on the things that you can control, because genetic things, if you've inherited these genes, as of today, maybe someday in the future, but as of today, we can't modify those genes. So the genes you have are the genes you have. But we know that a lot of things affect gene expression. So this has to do with the concept of epigenetics, things that go on around the genes and affect whether genes turn off or on, or when they turn off or on. And those are mostly lifestyle factors. And again, these are the things that we can control. So things like smoking, physical inactivity, an unhealthy diet, excessive alcohol consumption, those are all things that can affect gene expression for heart disease and also cause it. But again, it's not just that if you have these genes that you're destined to have a problem. So let's talk a little more about these lifestyle changes that you can make. So first, of course, diet and nutrition. We want you to follow a healthy plant-based diet. So shoot for a whole food plant-based diet. So as close to things as you can in their natural form. So fruits, vegetables, whole grains, beans, nuts, seeds, legumes, green leafy vegetables, all of these things we know are good for our health. And avoid processed foods. I recommend that people avoid animals or animal products. Avoid fats, especially saturated fats. So all those things can affect our health. Aim for a whole food plant-based diet. And then check if you do buy things in cans or packages, make sure you look at the labels. You want low sodium content. You want the least amount of ingredients possible. So when you're getting, say, canned corn, you look at the label and it should be corn and water, right? That should be it. So no added preservatives or salt or sugar. Again, in food in its most natural form that you can find it. And then healthy cooking methods. So cooking in oil is not healthy. So try to limit your oil, maybe just a spritz of olive oil on your food. No deep frying, especially in animal fat. Roasting vegetables is a great way to eat your vegetables in a healthy manner. Air fry, you can get an air fryer and cut up your vegetables, spritz them with a little olive oil and season them with salt and pepper, and air fry them. I usually do 300 degrees for 8 minutes and shake them in between halfway, and that's a great way to cook, for example, roasted carrots, roasted peppers, roasted broccoli. One of our favorite things at our house is air fried kale. So you take a bunch of green kale and you wash it and take it off the hard stalk in little bite-sized pieces, and you throw this pile of kale in your air fryer, spritz it with a little olive oil, add some salt and pepper, and air fry it at 300 degrees for 5 or 6 minutes, however crispy you like it. Makes great kale chips. You can do that with beets as well. So just experiment with some different healthy foods and ways to cook them. You might find that you enjoy healthy food. Then, of course, physical activity. It's important for us to stay active and stay moving. So the American Heart Association recommends 150 minutes of moderate intensity aerobic exercise every week. So like a brisk walk, 150 minutes a week. And then, of course, we need to add a couple of days of resistance exercises for our bones and muscles. Then think about new ways to move. So maybe you don't like to go to the gym or walk on the treadmill. You can sweep your floor every day, or sweep the driveway, or garden. So some way to move that you don't consider exercise. So that's a good way to help you be active as well. Stress management is important. Of course, different ways to manage stress would be things like exercise does that for some people, going on a walk in nature does that for some people, journaling, reading a book for pleasure, meditation, yoga. Again, just experiment with some different things and find what works best for you. Cutting out risky substances is important, so hopefully everyone knows by now that smoking's not good for your health. It's bad for your heart and your lungs and everything. If you can, you need to stop smoking. Vaping is not a great substitute, so we don't want you to vape either. So if you're vaping to quit smoking as a bridge, that's fine for a little bit, but try to stop vaping as well. The guidelines on alcohol, you may have heard in the past that a glass or two of red wine is good for your heart. Most cardiologists are not recommending that any longer. The data was reviewed a year or so ago, and the data wasn't that great. Plus, we know now that alcohol causes a lot of other issues, problems with brain health, issues, of course, with your liver, problems with balance, and which becomes more important as we age. So I recommend, and there's increased risk of certain cancers with alcohol. Breast cancer is an example. So I recommend to people that they cut out their alcohol. Marijuana is another toxin. This is evolving. We don't have a lot of data on marijuana yet, but as marijuana becomes legal in more places, we're seeing more data come out. And the data that's coming out regarding the heart is not good, showing that marijuana increases risk of heart attacks and strokes, can elevate blood pressure, and cause abnormal heart rhythms. So again, I would abstain from marijuana. Sometimes genetic factors can be things like elevated LP little a. Sometimes that can run in families, and that can increase risk of having atherosclerosis, blockage, or heart attacks. And we find that on blood work. Of course, people can have familial hypercholesterolemia, which is elevated. Often that's elevated LDL cholesterol, and that can run in families. And sometimes, despite lifestyle factors, those numbers can stay high still, and sometimes people need medications, such as statin medications. But again, the goal is to be able to use the lowest dose possible of a prescription medicine, if we have to, in conjunction with these lifestyle modifications. And then if you continue to have questions or concerns, it's a great idea to see a cardiologist for their thoughts. Someone like me especially is helpful, a preventive cardiologist. There are different types of cardiologists. Some types of cardiologists treat you when you come in with a heart attack. Some treat different abnormal heart rhythms. So a general cardiologist or more preventive cardiologist like I am, they focus on helping you prevent the heart attacks and the heart failure and the abnormal heart rhythms in the first place. And you can always reach out to me for help. You can reach me. My website is www.hearthealth.care. And you can email me at drtracy@hearthealth.care. So DRTRACY @hearthealth.care. And I can help you as well, or lead you to some resources. There are some great resources on my website. Certainly, there are different types of heart disease that run in families. But the main thing I want you to take from this talk today is that even though heart disease can be genetic and run in families, 80 to 90% of it is under your control. So that should empower you, make you feel like you have more control over things, and not be sad or depressed because everybody in your family has heart attacks or strokes and there's nothing you can do about it and you're destined to meet that fate as well. That's just not true. So there is a lot you can do, and that should empower you to make changes in your life to lower your risk as much as you can. All right, join me next time for another discussion on heart health. Thanks.